If you're dealing with hip pain or hip arthritis that just won't go away, whether it's aching at night, limiting how far you can walk, or making it hard to get up from a chair, you're not alone. Most people are told that it's just a part of aging, or worse, you'll eventually need a hip replacement. Maybe you've tried physical therapy, injections, stretching, or resting, and you still feel stuck. The usual medical path is they tell you you have arthritis and they send you home with some anti-inflammatories, or they recommend a cortisone shot. Some people will get imaging showing bone on bone and they're told surgery is their only option. Rarely do they explore why your hip is degenerating or whether the tissues around it can be healed to improve your function. And that's exactly why so many people feel frustrated, hopeless, and even scared about losing their independence. But there's good news. Today I'm going to show you why we're getting faster results with non-invasive regenerative shockwave therapy, even in people that were told they were bone on bone. You will learn why it works, what it actually treats, and how to know if this approach is right for you. Let's start with what's actually going on in your hip and what most doctors are missing. So what do you notice? What we notice is if your hip is in pain or you have arthritis, you might have a deep ache in the front of your hip. You may have stiffness in the morning or getting up after sitting, trouble tying your shoes, or pain after walking. And when it gets worse, it will refer down into your thigh, and your buttock may also be affected. Sleep is a problem, and even daily tasks like getting out of the car and standing for long periods of time can be excruciating. So what are some of the common limitations that we find? So some of the common limitations that we find are going to be in our hip. So one limitation is you'll notice that hip flexion, like it'll feel like it's stuck, like it just doesn't want to move, compared to the other side that'll feel like there's a lot more cushion. We'll notice that internal rotation, it'll be blocked, it'll be limited. You'll have a hard time doing this. External, you can do it, but it's definitely going to be stiffer on the side that's effective compared to the other side. You can also get issues into that lower back. So if you've been doing everything for your lower back and you haven't been able to find something, a solution for it, your hip might be the reason why that lower back is feeling tight. You'll be stiff, really stiff. Like if you've been lying down for a while and then you get up, you may even have stiffness in that lower back that is really coming from that hip. So other things that you'll notice is that you'll have tightness. Sometimes people will get tightness in their obliques and through here. Because the obliques attach into the pelvis down through here, they will attach in here. This area can also be tight. Not on everyone, just on some of the people. So another big common thing that we find is we just cannot find anything to get those glutes to fire. It is so hard to get those glutes to fire. And you'll find a lot of compensation in the front. The front of the muscles will actually give us a lot of compensation where they're being used because you can't get anything in the back to fire. So when we look at stuff, where people have a lot of issues in through here, there's a lot of muscles that attach into those hips and through here. And what we find is that even if you don't have hip arthritis per se, maybe you have just some general hip pain that's located in the knee, that's located in the hip or the front of the hip and even into the back. What we find is you can have a lot of like tissues through here that become a little bit more, have more fibrosis. And this is where shockwave comes into play to kind of help us. So a lot of the musculars through here, you'll have a lot of tightness around where the hip joint is. So that's where the hip joint will be. There'll be a lot of tightness through here. You'll have people, this is the sacrotuberous ligament. This gets super tight with people. I can just kind of find it right here, and people will jump off the table. Yep, very, very common. We've got to work in through there as well. And then the front parts of the hip that get affected, your adductors, which are in the front through here, they attach all in through here. And when you attach through here, you won't even notice that you're having issues in the front, but it's also some of the reason why you'll get some pain through that front part of the leg. It's because of the adductors attaching through here from all that protection. And then you'll have your quad that comes up here that attaches up and through here. So these are all the areas that are effective that we work in our treatment. So what is shockwave? Shockwave is, that's what these units are right here. We have focus shockwave and we have radial shockwave. Focus shockwave is an acoustic, it's high energy acoustic sound waves. And what this really does is when you have tissues that have adhesions, calcifications, fibrosis, scarring, any of those kind of things that happen, what happens is there's a lack of blood supply in those areas. And so this will actually revascularize those areas to really kind of make what I call the tissue young again, because it can bring all the nutrients to start that whole healing process again. But the focus shockwave also produces stem cells. And you have to have the focus shockwave when you want to work on the hip, which is not a lot of offices have this. Because the hip is a deep tissue. And let's say you do have some arthritis that we are addressing. You're going to hit those same areas, but it's going to be slightly different treatment. This is where the hip joint is. And we basically take it through here, and we can take the focus shockwave and go all the way through the hip joint to basically start healing that bone again. Again, lack of blood supply, whether it's to a tissue, to a bone, is what happens a lot of times, and it revascularizes that area to produce more blood flow in those areas to start like the whole healing process again. That's kind of what it does. So that's what the focus shockwave does. The radial shockwave works on more of the tissues. It's the unit that's down below. Don't think you can quite see it, but that's okay. And so the radial shockwave will work on tissues that are going to be a little bit more superficial when it's more soft tissue type thing. Focus is going to be something that we want to pinpoint areas because it's going to be a more focused treatment. So how do we treat the hip? We use the radial shockwave, which is what this head is, and it's kind of like what I showed people is we want to start down low and through here, because this is where a lot of the adductors attach, is right in through here. They come up and attaches into the pelvis, all the way up and through the front part of this pelvis. That's where it attaches. And so we'll be doing treatment from here all the way up through here. We'll take it through the crease and in through that front part of the quad where it attaches to that top part of that pelvis. That's what the radial shockwave will do. So that's really the treatment part that we work from there. Then we use the focus. And with the focus, this is kind of what it looks like. You will use different heads. So when you don't have anything on it, this can go 12.5 centimeters in depth. It can go really deep. So some of the treatment we're going to use without it, and other treatments we're going to use a head that is a little bit smaller. They have different heads so if we need something a little bit more superficial, we're going to use this. If we want to go a little bit deeper but not as deep, we're going to use this head right through here. So when we do this, then we're going to take it on the hips and pretend like we're going to use it all on the hip musculatures. So we'll take it and we'll turn it on, and we'll find the range where people can actually really feel it, and we'll have them on their side so we can get all around this joint, this bone joint right here. So here's where the leg is. This is where a lot of attachments are, and it's an area that is a problem area. So we hit the radial, the focus through this whole area. And then remember when I showed you the sacrotuberous ligament, it's in through here. We also treat all in through here. You'll find the spots. Usually it's almost kind of angled in that direction to hit this whole area. So we'll have them on their stomach when we hit that. And then to get the hip joint, the muscles in through here, we literally will take the radial and go all through here to find it. Usually when we get to the very center of it, we will not use, when we need to go a little bit deeper in the center through here, we'll just work through this area. If there's fibrous tissue, we'll actually move this. Normally you don't move this. Normally you find the spot and you hit it. If it's more of an arthritic hip, we're gonna find the spots and we're gonna hit it. And so when we don't think that the hip is really arthritic and there's any problems, this is the only time when you actually use this, and you'll just kind of move it slowly, because you're gonna find this whole area through here just like lights people up. And so when we use this, usually after the first treatment, people notice significant changes. Like we had a client that came in, was having a hard time cycling. She was having pain, like even just sleeping. And she's like, oh my gosh, I have this training that's going up. And I've got to get back as quickly as possible. So she came in and we did this exact same treatment on her. And we followed up with her. This literally happened this week. Followed up with her the next day. She goes, feel amazing. I'm on a 20-mile bike ride, haven't hurt at all, and I'm able to sleep without any pain for the first time and since this kind of started bothering her. So like that's how quickly these treatments can work. Now it'll kind of slowly come back. You have to do 6 of them. 6 of them is the recommended treatment, but I'm just going to tell you, you're going to get so much farther doing these treatments than you would be doing anything else. I haven't found anything else out there on the market that does what this does and as quickly as what this does, with as many variations of how we can treat people. Some things can only work on a certain body part. This works on, if it's musculoskeletal, we got you. Even nervous system, we got you on stuff like this. So that is how we do the treatment. And if you're interested in learning more on this, then stay tuned and we'll talk more about how you can work with us. So if you've been told your only option is surgery, or you've been frustrated by the lack of progress with traditional therapy, don't give up. There are other solutions. Drop a comment if this sounds like you, and don't forget to like this video if you found it helpful. If you are near the DFW area, we're offering a free live event on August the 18th where we'll go even deeper into how to heal your joint pain with regenerative therapy. The first 10 people will get $300 bonus off on treatment as a gift. So check out the description below for some free resources for back and hip pain solutions. And don't forget to subscribe. We have more videos coming on natural pain relief that works.